Hi again, my name is Delene Grant, and we are now at part 7 of my motor vehicle accident presentation. And just letting you know again that these companies that I've listed are responsible for everything that happened to me here in Canada. The system came down on me. It's systemic racism. It's called systemic racism. Okay? Please feel free again to pause and read as I go along. I'm going to try to be as quick as possible. Okay? Thanks. August 10th, as you remember, please feel free to pause and read. Okay? I complained of chest pain since August 10th, August 8th, 2019, motor vehicle accident. Chest area became swollen after a few months with on and off pain, right? Pain became worse in June 2020, and did not trust the doctors. I did not, I was then recommended to a Christian doctor who would be able to assist me. I did not trust the doctors here because each time I go to a doctor, they actually would write, I will go, but they're writing something else. Unless I see, ask for a copy of the record, then I would see that they definitely would be writing things that doesn't pertain to me. And this again is adding to my medical records at the Ministry of Health. Okay, so as a proof here that I had chest pains, right? Chest pains. Okay. Throughout all my visits, okay, I went to Dr. Assad because in July 2020, see that this area, discolored, swollen, and it's from the accident, okay? All right, so I sent it to a family member. Yeah, they were all freaking out. Yeah, my family was freaking out, so I had to see a doctor. So Dr. Assad was recommended. So nothing had changed. I went to Dr. Assad. Throughout my visit, nothing had changed. The medical system had left me to suffer with my injuries from the motor vehicle accident. Each time I visit a doctor or examination performed, false reports are provided to further add or in agreement with the false medical records from the Ministry of Health. Due to my injuries, I have been limited in my activities if I walk, sit, or stand. My legs are swollen. I have black floaters before my eyes. Yeah, something I told you went in my eye and all that, right? My eyes at times have burning sensation and are watery. Doctors had at a point had pointed out that I had lumbar spine issue. Remember that? I told the doctor, did me wrong, didn't have lumbar spine, didn't have spine issue at all. And he said it wasn't the lumbar spine issue I had before and not a result of the motor vehicle accident. Okay. That was a mouthful, okay. Send picture of swollen chest area to a family via WhatsApp, family member. Okay. Please feel free to review. Okay, because of my legs, like this vein, it was burning and paining sometimes. Yeah, when Dr. Assad complained about it. Okay, swollen vein at back of leg also had burning sensation and pain. One of the many complaints. Okay. Was it because of the distorted medical records from the Ministry of Health was the reason why Dr. Samir Assad decided to perform a complete examination, okay? Which included various types of x-rays, exposure to unnecessary radiation. Yeah. From the motor vehicle accident, I remember my pain. My face was in pain. Now and again, that happened. My face would be in terrible pain, and then I realized, I was singing, and I sing, and I realized that my jaw, my teeth, my teeth look different. Yeah, then I realized that, oh, my jaw is twisted. It's either my jaw or chin is twisted. Never had issue prior to motor vehicle accident, right? It's a jaw and facial pain after a car accident. Yeah, right. And I told Dr. Assad, okay, yeah. Still, now and again, I have to massage my face because I still feel pain now and again. Okay, here though, this was during COVID when I visited Dr. Assad, and he said, you can book appointment online, but I normally get my appointment when I went there for the first time. I get my appointment there and then, so I don't have to book, right? However, it states here, this is a sheet. You see it more in the next slide. It says Dr. Assad will only address one issue per visit. One issue per visit. I had several. Should you have more than 2 issues, please schedule a second appointment. Okay. Please feel free to read. This is what I have been experiencing too. Okay, regarding my jaw and facial pain. Yeah. Here you can see the information. That's it there. That's it there. Dr. Assad, I think I can enlarge it. Yes, I can. Dr. Assad will only address one issue. They have one issue per visit. Should you have more than 2 issues, you complete for a second appointment. As you can see, the second appointment. Okay, have that. Okay. So Dr. Assad sent me for, see, Dr. Assad, I was sent for blood work and urine test, okay? And I was also sent for mammogram. He told me, because I usually, again, the medical system did me wrong. And because of that, I was supposed to be doing yearly mammogram. And because I no longer trust the medical system since 2020, I think 17 or 18, I ceased getting a mammogram done. They did me wrong. Okay, that's another story. All right, we keep trusting the medical system, and we're not understanding that sometimes there are good doctors around. I'm not gonna say they're all the same. I believe that there are good doctors around, but there are some that are corrupt. You understand? And they can do us wrong and we don't know it. Okay, they have done me wrong, right? So the doctor realized that I haven't done mammogram in a while, so I was sent for a mammogram. However, I thought it was just only for a mammogram. Okay, when I went to do the mammogram, I will let you know about the other thing that happened. Okay, while I know I've been doing mammogram for years, and normally when I go for a mammogram, which can be, oh my God, it's terrible. It's terrible. It's painful, that I should say, right? Normally the radiographer would say, I'll tell you when to hold your breath. And usually when she leaves me there, don't move, she would say, okay, hold your breath. And I would hold my breath and she can do whatever. This one was different, right? I see Dr. Assad, right? Sent me, and I went to Dixie X-ray. And then the radiographer, when my breast was clamped on the thing, right? It wasn't as painful as the other times that I have done my tests, right? And then she walked away and said nothing. Then I quickly said, should I hold my breath now? And she said, no, I don't have to hold my breath. So I didn't, because just in case, I could have held my breath, and then whatever may have changed in the examination of the breast, I didn't want to hinder anything, so I followed her instruction. No, I didn't have to hold my breath, right? I got concerned, so when I went home, I had to look it up, okay? Because first time in all my years being told not to hold my breath, okay? It says here, hold your breath to protect your breast and heart. Breast and heart. Women who have breast cancer on their left side present a particular challenge to radiation. Okay, it says new research shows a woman who holds her breath during radiation pulses can greatly reduce radiation exposure to the heart. Did you see that? Recent studies have shown women with cancer in the left breast, please feel free to read. Here it says, your breast must be compressed to even out its thickness and permit the X-ray penetrate the breast tissue. During the brief X-ray exposure, you will be asked to stand still and hold your breath. This radiographer did not provide instruction, and then I don't think it was even out to prevent the X-ray, because I told you the clamping wasn't as hard, wasn't as painful as my previous. Go figure. Okay? Wow. I would say they're trying to cause further damage to my body, eh? Okay, what do you think? Please feel free to pause and read, okay? Okay, after my mammogram, I was ushered into another room. I was wondering what was that all about. I guess I should have read. I don't know. Yeah, I should have read. Okay. Here it is. No, this one. This is a result. This is another thing, right? I was actually on August 6th. It was the same date of the mammogram, and I did not know that. I guess that's why afterwards I started to photocopy. This is another date. I started to copy the requisition. I tell you, I take a picture of. I didn't take a picture of the first requisition, that didn't know that it had bone density on it, and this is for lumbar spine. You see that lumbar spine, right? Because of what's on my medical records, or maybe in the system, they did a bone density test on me on August 6th. And it says, when I look it up, I got concerned. Clinical, there are no previous bone density studies for comparison. Exactly, because my doctor, Dr. James Chang, when he misdiagnosed me for this lumbar spine, whatever, he was wrong. It's a couple years after he corrected his diagnosis, because and he did not correct whatever, if it's there on the medical records. So he did not do an exam on me then. These doctors it's like some of these doctors love to assume that you have whatever, and without performing any examination. Okay, as per internet, bone density is for people 65 years and over. Why was I sent for this test without being informed by Dr. Assad? Dr. Assad should have said something to me. I would have told him no. I was taken by unawares the same day I went for mammogram. Okay, I brought this one forward on August 25th because I was complaining of burning sensation. I said I complained of tingling, nervy burning sensation, and numbness in both legs, and was sent for another x-ray. I thought it was an MRI. Yeah, I was caught off guard again. Didn't realize it was an x-ray, because didn't know it was an x-ray at all, because burning sensation and all that is not bone related. And I was sent for an x-ray. Wow. Was my lumbar spine x-ray twice in a month? It says lumbar spine here. Yeah. On August 6th, right? And on August 25th. Yeah, please feel free to pause and read. Thank you. Okay. This is my concern. Okay. And it says another commonly injured area in car accident is your lower back. Right? Car accident victims usually complain about lower back pain, stiffness, and tenderness. In case of more severe injuries, the person will have pain radiation to the buttocks or down the legs, usually in combination with tingling, numbness, loss of strength, etc. You see, I was complaining about all that. It's because of this x-ray, this information, and I decided to look things up. Don't you think, I'm in danger of the medical system here, eh? Because if I should go to a doctor, if it's not the right doctor or one with integrity, they'll continue to mess up my medical records, making up false information on my medical records. It's just disheartening. Please feel free to pause and read. Okay, thank you. The numbness and tingling, nerve damage caused by car accident can happen a number of ways, including whiplash, spinal disc injury, whatever. Yeah, Yeah, please feel free to pause and read. Blunt forces trauma to the head, arms, or legs, and deep cuts. You know, I receive um, injury from the car accident, and up to that point in time, I'm not gonna think that I am being really they are really looking about me regarding the car accident. I just think that what I'm feeling, that they were actually causing more damage to me. Yeah. Tingling and numbness, although bothersome, can be temporary and go away. Yeah, it's bothersome. Yeah, now and again. Yeah, now and again didn't go away. Now and again it is there. Please feel free to pause and read, okay? If you're experiencing pain, numbness, or tingling in your extremities or limbs, remember when I said um, um, musculoskeleton. Remember from my medical records when in my first presentation, and it talked about um, your musculoskeletal system not yet diagnosed leg. That this seems familiar. We talk about extremities or limbs after an auto accident, motorcycle accident, or whatever. It would seem as if they had planned for me and my legs, planned for me and my musculoskeleton system. Please feel free to pause and read. Okay? All right. I remember the doctor record that I had whiplash and all that, and pain and pain. It's after getting whiplash, individual often complain of discomfort in the neck, followed by stiffness, tenderness, and pain while moving the neck, and all that. I am complaining, and these doctors ignored me. It's like, suffer, Delane, suffer. Wow, nerve damage caused by car accident can happen a number of ways. Please feel free to pause and read, okay? More information regarding motor vehicle accident, what I've experienced. X-rays are a great diagnostic tool for detecting bone injuries like fractures or dislocation. Okay, please feel free to pause and read. All right. All this information I am giving just for you to pause and read. In the event that you experience numbness, tingling, pain, radiation, or loss of strength, it can indicate a possible nerve root injury, and you can insist on an MRI. Look at that, eh? I thought Dr. Assad would send me for MRI. I'm not a doctor, but guarantee I know that it could not be an X-ray because it was not bone related. Whatever I was experiencing, it was not bone related, and Dr. Assad sent me twice within the month of August for X-ray. Yeah, the MRI findings will have a significant impact on future treatment methods. Yeah, nothing, no. Okay, so should I say Dr. Assad was a part of this thing too? Please feel free to pause and read. Yeah, yeah. Okay, please feel free to pause and read. What causes back pain after a car crash? All my pain. Remember in the medical report they had sprains and strains, yeah? The spinal disc damage, joint injuries. After a car accident, remain alert for delayed symptoms of back injuries. During traumatic event, your body releases a massive adrenaline rush that may mark normal pain signals directly following a car crash. Even if you feel fine immediately after the accident, please feel free to pause and read this. Enough information here. The doctors refused to assist me. Okay? Thank you.